Hey, I'm back. It's Tina from Virginia Beach Home Therapies with the second half of fluid management. We were going to talk about dehydration. All right. So the other end of the spectrum of fluid overload is dehydration. All right. So how can we get to dehydration? Basically using too high strength of solution. Using too many 4.25s. The doctor told you to use 4.25s. Didn't give you an end date. Or if you say, well, normally I use 4.25s because I haven't been able to UF a lot with my 2.5s. That's an indicator to call your nurse. Sometimes patients end up saying, well, I was using 2.5s. That's what all I do. But have you been drinking enough? Have you been urinating enough? So if you've been urinating more and not drinking enough, sometimes your body just didn't know how to stop it. And when you use too many higher strengths or even the medium strength solution, it could take you into a dehydration because the PD fluid is just going to do what we want it to do. And the patient or the nurse has to help to make sure that dehydration doesn't occur or fluid overload doesn't occur. All right, so what happens in dehydration? What are the symptoms? My writing still hasn't gotten any better. Okay, so symptoms is you might have a decrease in weight, all right, a decrease in blood pressure, elevated heart rate, and now you might even have an elevated temperature. All right. In dehydration, you can feel drained easily as well. All right. Dizzy. Sorry, dizzy is another one. And or lightheaded, faint, or something like that. You might even get a little nausea, diarrhea. I forgot vomiting. Vomiting is up in there too. For some reason, when the body doesn't have enough fluid, your body ends up letting go fluid for some reason. There is a reason, but we won't get into that. These are the symptoms of dehydration. All right. If you have dehydration, I love colors, guys. All right. The action plan would be always using those 1.5s. We're gonna start off with changing the strength of solution. Okay. Say if you just can't even get up to do your dialysis, let's just lay down. Let's not fall. All right. Let's not have any injuries with low blood pressure, okay, or with the fainting spell and dehydration. All right. When you can sit up, drink more. Eat more. So when I say eat more, all the things that you were told not to have, you can have now. Because they're probably more appetizing because you were nauseous, possibly. All right? So eat those salty foods as much as you can because like I said in the prior video, the salt that's in those foods, the water that you take in will hold on to that sodium, okay? Now, say if you drinking, you eating, you laying down, you sit back up, your blood pressure is still low. You may just skip an exchange. So you end up going from every 6 to 8 hours is the norm. Normal dwell time, all right, to doing 10 to 12 hours of dwell. That is potentially a skip exchange. In this 6 to 8 hours, you may have 0 UF, okay? In the 10 to 12, you may have negative 200. So say if you can't drink or eat, you're now drinking 200 or holding on to 200 of your PD solution. All right. Hopefully you can do your exchange after 12 hours. All right. If your blood pressure is still low, definitely call the nurse. Call nurse. Because you might have to hold your BP meds or your diuretic or both. Okay? So your nurse usually gives that indicator, but if you smart, you good, you know that your blood pressure is, let's say 100 over, let's say 70, and you know you got to take about 3 different meds. If you know what to do, go ahead and hold them. If it's not a cardiac medication, definitely you could probably hold it, but call the nurse. I don't want to send you guys the wrong way. So basically, this is what I tell my patients of how to manage their their dehydration, fluid overload. Please don't pay attention to too much of like what the UF is. Like say if your UF is, I just had a phone conversation with a patient. So basically, if your UF is lower than the norm during your cyclotron, your manual exchanges or something like that, if it's low and your blood pressure is a norm or on the lower end, that's fine. Your body probably needs the fluid that it's holding on to. So if you have questions of why things are, and you just feel like I kind of think I know, call your nurse. All right. Well, guys, that's all I have for fluid management right now for peritoneal dialysis. I'll catch you in the next video.